And on the line now is my next guest, and that's Dr. Abbondanza, and he is going to be talking about cosmetic dentistry, how to get a mouth makeover, and he's on the line now. Good morning.
Good morning, Kerry.
And thanks for taking out time from your busy practice.
Not a problem. It's a pleasure.
Educate us on how to get a mouth makeover.
Yes.
Yeah, okay. Well, let's start out with this. Consumers have a range of options to choose from when looking to enhance their pearly whites. First of all, has there been a shift in the way that people are more eager to have this done? Is it more acceptable now and not just thought of as vanity?
Oh, absolutely. I mean, just about all of our patients inquire into tooth whitening and other things, so it's much more acceptable for both males and females, and people, the demand has just been overwhelming, and I think every dentist is experiencing that.
All right. And I guess what maybe has given it a bit of publicity is shows like Extreme Makeover, when you can see the extreme difference and how much better they look. But look, let's look at the different procedures and about how much they cost and about how long they last. So let's look at whitening or bleaching.
Well, with whitening, basically there's many procedures. Obviously you have the toothpaste on the counter at the supermarket, or you have in-chair whitening, or you have take-home whitening, and those procedures.
And let's start out with the toothpaste you can buy at the shop. Is it really worth it? I mean, are the results...
Well, what we find are the results, people don't really get the results that they want. The problem with that is it's a low concentration whitening solution, and the solution is not that strong, and it really needs to be used over a long period of time for any result, if the result is that good at all. Whereas the solutions that dentists use are much stronger, and the procedures that we use, you get a much more instant result. That is also gets a much brighter result as well. Okay,
and let's talk about the two procedures. For example, one can be done in the dentist at one time, right? And the other one they can take home a kit. But let's talk about the one in the office. It can be done in one day? It
can be done in one day. In fact, it can be done in about an hour and a half. And the procedure... Basically what the procedure is in the chair is we've got a light that accelerates the whitening solution, and basically the patients walk out of there with whiter teeth. Now they're also given trays to take home, and they use those trays with the whitening solution for the next couple of nights as well, just to finalise the results. But what we find with the whitening in the chair is the results happen much more quicker and much more brighter. As opposed to the take-home kits where the patient's issued with the trays and they need to whiten their teeth over a period of about a week or longer, for about 4 to 6 hours a day.
And so the one in the office, I mean, that sounds so much easier, but of course that's more expensive. Let's just get a rough idea.
Well, whitening, in the office can start from $500 and go up to about $1,500. The average would probably be about $800 to $1,000.
Okay, but it's over in that, like you say, the hour and a half.
Yes.
And look, let's look at the maintenance of that. Is there anything you have to do, and about how long does it last?
Well, yes, there is take-home instructions, and that basically when you go home for about 48 hours, you shouldn't have anything that would stain a white shirt, such as wine, coffee, tea, or anything like that. In the first 48 hours. After that, obviously, you can have that, but you have to bear in mind that those things do sort of reduce the result over the longer term. However, basically with whitening, you get a baseline result which is very white, and it stays that way for a long period of time, and it's only basically time and things such as coffee and tea that can bring it back a few notches. But what we do for that is we give people a top-up kit, and they may just want to top up every couple of years, and it just brings their teeth down that shade lighter. So we have excellent results over years. So
are you saying that if you didn't have any things that could stain your teeth, which I know would be really unlikely, but if that was the case, you might not need the top-up?
That's right. However, over time, such as over the period of about 40 years, teeth do mature and they do become a little bit more yellow. That's just their innate quality. So that's something that also can cause the teeth to go that a little bit yellow.
And and also with the top-up, and how much more would that be, just roughly?
A top-up kit ranges for about $100 to $200, basically.
All right, and you're going to get that, so you don't have to go through the whole procedure again?
No, absolutely not. Although some people want to, but it's not necessary, no.
All right, and anyway, this can it doesn't cause any frailty to the teeth? Nothing like that?
No, it doesn't. There's no frailty to the teeth, and there's no long-term damage to the teeth. The only short-term issue that they may experience is sensitivity to the teeth, but that is very short-lived.
All right. Okay, and let's look at the next one. And I'm talking to dentist Dr. Daniel Abbondanza, and we're talking about how to get a mouth makeover, because, I mean, a beautiful smile it's kind of everything, isn't it?
Absolutely. It makes up your psyche.
It's really lovely. Let's look at the next one, porcelain and ceramic veneers. When would you get those done? What would they be done for?
Oh, well, porcelain ceramic veneers can be done for many things, for worn, stained, cracked, uneven teeth, or even slightly crooked teeth can have porcelain veneers. And when a tooth is really badly broken down, we can actually strengthen it with a porcelain veneer. So that may be an instance where we're providing a good situation for someone's teeth. But many times people opt for veneers in a cosmetic situation where they're not happy with their smile, and we can do great things to improve that.
And so these go over the teeth you already have?
Well, that's right. We do actually prepare the teeth. Now, the tooth basically has an enamel coating, and what we do is we do prepare a little bit of that. So we remove a little bit of that so we can bond the veneer to that, but it's very minimal.
All right. And veneers can change the shape of teeth.
Yes.
And close gaps between the teeth. So I guess if you've got a pointy tooth or there's a big gap, that can fix that.
It can fix that. Yes,
right.
Definitely.
And the cost of porcelain or ceramic veneers can vary from between $690 to $1,200 per tooth. And Doctor, just before we go on, what makes the cost high like that? Is it the specialised work?
It is. It's a specialised work, and the work that goes into the veneer. Basically, there's many appointments to do a ceramic veneer, and there's many procedures. There's a lot of preparation work to get a ceramic veneer right. We need to firstly identify what the patient wants, and we do that through mocking up what we can do, and we do that through a wax mock-up or a visual mock-up for the patient, and a lot of work goes into that. So we know exactly what the patient wants, and then we can derive a great result for them. So there's a lot of work, and there's also a lot of appointments where we just try the veneer in and often make a great deal of changes so that the patient's absolutely happy. So at the end of the day, there's no guesswork to what the patient's getting.
And let's go on to the next one, crowns, and how are they different from porcelain ceramic veneers?
Well, ceramic veneer basically goes on the outer surface of the tooth, whereas a crown surrounds the whole tooth. And we use crowns in situations where the tooth is severely broken down, and that would be the difference there for just a really severely broken down tooth.
Okay, so the tooth actually could be broken,
yes,
right? And or maybe cracked and stuff, and you would build up that tooth with the crown so that it looks like a normal tooth.
It looks like a normal tooth, absolutely.
All right, and let's just look at the different kinds. People can choose from gold crowns. Let's go over the different kinds, and how does somebody make the best decision on that? They ask their dentist, I guess.
Yes, well, the dentist is the best person to ask.
Yeah.
There's many types of crowns. Basically, there's gold crowns, there's a metal ceramic crowns, or there's all ceramic crowns. Basically, over time, there's been a shift where the materials we use are getting much better and much more aesthetic. So what we find in our practice is people don't want to opt for a gold crown anymore. They want something that looks a lot better. So we can offer them a metal ceramic crown or an all ceramic crown, and they offer the most lifelike
sure,
appearance.
And it just blends in.
It just blends in, and you can't tell it's a crown at all.
In fact, do you even get asked for gold crowns anymore?
We offer that to patients, but no, we don't. They prefer not to.
All right, yeah, they're just a more natural, more natural sort of look.
Yes.
And look, also going with the crown, this might be news to a lot of people. The type of work often involves a gum lift.
Yes.
Tell us why, when you think that's necessary.
Well, when looking at a smile, it's not only the teeth which provide the smile, it's also the gums and the lips. And sometimes people have uneven gums, and we can harmonise everything by doing a gum lift. Or some people may have a really gummy smile, and what we do is we actually raise their gums up so they show a lot more teeth. So that's very important in designing a good smile, is actually contemplating getting a gum lift as well, which is a very minor procedure, and the results after doing that are exceptional.
All right. And crowns cost anywhere between $1,150 and $1,800 per tooth, while a gum lift can set you back $250 to $500 per tooth. And the gum lift, how long does that take?
The gum lift...
That's just done that day?
It's done on a day, basically. Yeah. Okay. For one tooth, typically it might take about 30 minutes to an hour. For more teeth, it may take a little bit longer, and that's just done under local anaesthetic and quite a minor procedure.
All right. And if another reason I'm thinking too is occasionally you'll see people that look like they've only got little teeth, but their gums come so far down.
Absolutely.
So on a cosmetic way, that can fix that.
That can fix that problem, yes,
right.
Absolutely.
And let's go on to the next one, bridges and implants. And they're essentially false teeth? Essentially,
yeah. It's basically prosthetics to replace missing teeth. What a bridge is when you have a missing tooth, what a bridge does is it utilises the teeth either side of that missing tooth, and what we do is we hang a false tooth off of that, and it can replace the tooth. Or alternatively, to replace a missing tooth, what we can use is an implant, which is basically like a tooth root, which is made out of titanium, which is placed into the jawbone, and then we place a tooth on top of it, and an implant is possibly the most lifelike replacement of a missing tooth.
And just give us an idea of the cost of implants. How generally, just one would be done? For
one implant, there's many scenarios. For one implant, the cost of one implant generally is $4,500, but it can go up to about $6,000, and that's a general ballpark figure. But also, implants can be used for many other things for people that have dentures and can't function satisfactorily with them. We can use implants to replace their denture.
And is there an advantage in having the implant as opposed to the bridge?
There is, because it stands alone and you don't involve the teeth either side. To do a bridge, you often have to cut back the teeth either side, and that can cause some damage to the teeth, and that is sometimes not a good thing. So it is advantageous to have an implant because it stands alone and it doesn't tie up the teeth either side. And the other advantage is an implant lasts for much longer. An implant is more of a lifetime solution rather than an interim solution like a bridge may last for about 15 years.
All right, and in finishing up, other procedures, patients can have a range of other dental work performed, including having chipped, crooked and misaligned teeth reshaped, and known as, all right, I'll get you to say this.
Are you talking about odontoplasty?
Yeah.
Yes, yeah. Often what we can do is just reshape teeth which have got an odd shape, and that's very straightforward to do, basically, and it happens in a matter of about 5 to 10 minutes.
Okay. And Doctor, what kind of satisfaction do you get as a dentist on seeing somebody kind of transformed?
Oh, absolutely. That's probably the most exciting work that I do, seeing someone transformed, and also the change to their psyche and appearance is fantastic, and it's probably the work that I enjoy doing the most.
All right. And just finally, though, you go out and about, right, and you do see people and they might have a tooth missing rather at the front of their mouth. Is that because they might have a fear of dentistry when you see an obvious...
Absolutely. Well, it could be many reasons why they haven't opted to get that replaced, but I think it could be a fear. A fear is obviously something which people still have of dentists.
Because it's so noticeable, you know, it's so absolutely noticeable and detracts from their attractiveness. I wondered if that was the reason.
Absolutely, and lots of things can be done, so fear is a big component of that, and I mean, things have changed a great deal now, and there shouldn't be a lot of fear for dentists anymore, because we practice lots of pain-free techniques, and hopefully that fear will go away for a lot of these people.
So no matter what a person's apprehension is, you can work with that person.
Yes, absolutely.
And just make it comfortable. And those chairs are so comfortable, you could just go to sleep in them.
And many people do, yes.
All right. Well, thank you so much for talking to us.
Not a problem,
and giving us the education on how to get a mouth makeover. And Dr. Abbondanza, that's Dr. Daniel Abbondanza, and he's a dentist in Perth. And thank you again for your time.
Not a problem, Kerry. Thank you. Right.